Good afternoon, everyone. Thank you for joining us. I'm Janelle Heinrich, Director of Public Health, Madison and Dane County. First, I'd like to take just a moment to give a brief snapshot of where things currently stand in terms of the amount of infection that we're seeing in Dane County. As you know, we are currently experiencing an unprecedented surge in COVID activity. Our current 7-day average is 1,249 individuals being diagnosed with COVID on a daily basis. Last week, around this time, it was around 870. Yesterday, we hit an all-time high for the number of people hospitalized in Dane County hospitals with COVID, 184. And today, that number is even higher at 197. Both these numbers are higher than our peak of 179 hospitalizations during the COVID surge we saw back in November of 2020. Not all are due to COVID, and not all are from Dane County, but the high levels of hospitalization and need for additional protocols when someone in the hospital tests positive for COVID creates strain on our system. Over the entire pandemic, more than 85,000 people, 15.5% of the entire population of Dane County has tested positive for COVID. Within the past 2 weeks, 3.1%, more than 1 out of every 50 people of the county has tested positive. This surge that we're in is a perfect storm, likely brought on by a combination of holiday travel and gatherings, just as this very highly transmissible Omicron variant began to spread. And it's not one that we in Dane County are alone in experiencing. The challenge that we're facing right now is a challenge that communities across the country are facing as well. And what the surge means is that there may be a high probability that you will be impacted, whether personally, at work, or in the community, since all sectors and all ages are being impacted by this illness. But we will get through this surge. There are things that you can do to help us get through it as well. Please stay home if you are feeling unwell, even if you think it's not COVID. Get tested if you are sick. Wear a well-fitting mask, and still, please get boosted or get vaccinated. Although people may be experiencing breakthrough infections, some of whom may feel quite poorly, vaccine is still very important in minimizing symptoms and preventing more severe outcomes, such as hospitalization or death. As we have done throughout all the twists and turns of this pandemic, Public Health Madison and Dane County is doing everything we can to adapt and help guide this community to the other side. We, the city and the county, are taking actions to increase testing, making vaccine more accessible, and making sure people are wearing well-fitting masks and have access to them. Last week, staff from throughout our department stepped up to provide 12 hours of testing per day at our South Madison office. Thanks to their efforts, more than 4,000 tests were conducted in just 1 week at that site, more than double our highest weekly number of tests at that location. This week, we are starting a new partnership with the Department of Health Services contracted testing lab, Accelerated Labs, and they opened an additional testing site at the at the Alliant Energy Center yesterday. They're already providing 750 tests per day, and next week operations will expand to 1,000 tests per day, and eventually opening up appointments on weekends as well. This extra testing capacity is in addition to the hours that we are offering at our South Madison Clinic and in other places across the community. And but a reminder, you do need an appointment. And people who make an appointment and register ahead of time are making their way in and out of the clinic in under 5 minutes. Please use one of these community test sites instead of the emergency department if you need a test. Though testing capacity has increased greatly in the past week, it may be possible you are not able to get a test as quickly as you would like. So please stay home if you are feeling unwell and waiting for that appointment. Let's preserve our healthcare capacity to care for those who need it. We know that testing is just one of the pieces of the puzzle that we need to deploy and engage in as a community to ease the impact this surge is having. So I'll hand it off to Mayor Rhodes Conway to share more about the work being done in mobile vaccination. Mayor?
Thank you, Janelle. I want to start by just reinforcing something that Janelle said and how important it is for folks who are not feeling well to stay home. So if you have symptoms, fever, cough, sore throat, loss of smell, that kind of thing, please do stay home. And I want to call on all employers in Madison to make that possible for your employees. It's very important that folks be able to take care of themselves and their families and not worry about their income or their employment. But perhaps more important than anything else is making sure that you are up to date on your COVID vaccine. It is so critically important, if you are vaccinated, to get your booster dose. And if you have not yet been vaccinated, to make your initial appointment right away. Vaccination continues to be the best tool that we have in preventing severe outcomes from COVID-19, including hospitalization and death. With our hospitals at capacity, we each have to do our part to keep ourselves safe and to keep ourselves out of the hospital. There are many options to get vaccinated or to get boosted. You can go to the arena at the Alliant Energy Center. There are plenty of appointments available, but walk-ins are also accepted. You can get vaccinated at our public health offices on South Park Street or on East Washington Avenue. And we are putting up mobile vaccination clinics at various businesses and organizations countywide. There will be at least 15, but often more than 15 mobile clinics each week. And I want to thank all of the community partners who are opening up their spaces to accommodate this service to the community. And last week, public health staff administered more than 500 doses of vaccine at these mobile clinics in just 5 days. So that's great news. I'm very excited that public health is offering this service again out in the community. And you can find out where the next mobile clinics are by going to the public health website, publichealthmdc.com/vax. That's publichealthmdc.com/VAX. Please, please, please get vaccinated, get boosted. It's the best way to protect yourself and your family and to keep out of our hospitals. Along with getting vaccinated, there are a few other things that you can do right now. Please, wear fitted mask, avoid crowded spaces, wash your hands frequently, get tested if you need to. And again, stay home if you're feeling sick, if you have a sore throat or a fever. And if you are an employer, support your employees in staying at home if they are sick. Thank you, everyone, for all you're doing to take care of yourselves and our community in this difficult time. And I'll hand it over to the county executive now.
Thank you, Mayor, and thank you, Janelle. And I want to give a special thank you to Janelle and the public health staff who have been stepping up not only for the last 2 years, but certainly redoubling their efforts over the last few weeks. We appreciate you very much. We know how exhausted you are, and we know what an incredible service you're providing to the community. So thank you for that. I'd also like to acknowledge the impossibly difficult challenges our healthcare providers, be they doctors, nurses, CNAs, et cetera, and others on the front lines of caring for people are facing as we speak today. At the beginning of this crisis, nearly 2 years ago, we recognized our healthcare workers as heroes, and that title is even more appropriate today. But today, after serving nearly 2 years on the front lines of this crisis, our healthcare heroes need our help, not just in words, but in our actions. They need us because they're exhausted. They've been pushed beyond their limits, but they continue to care for all of us in our times of need. There are many practical steps we can all take to protect ourselves and in turn lend a hand to our healthcare providers. We all know what those steps are, and frankly, we're all tired of hearing about them, but they are perhaps more important today than ever. So please get vaccinated, get boosted, wear a well-fitting mask, avoid large crowds. You know the drill. And this isn't about politics. It isn't about party. It's about doing the things we know can protect us from getting seriously ill and putting further strain on our hospitals. It's about rendering aid to our neighbors in need. By now, and certainly over the past month, nearly everyone has been impacted by COVID, be it at home, at work, at school, or in the community. Our road back to normal has been detoured. The roller coaster that this pandemic is continues. And understandably, we're all tired of it. We're all frustrated and just want it to be done. And one day it will be. But for now, we need to remain vigilant once again. We have a challenging month ahead of us, but there are practical things we can all do to protect ourselves and our neighbors and to reduce the burden on our hospitals. On local government's part, we have been and will continue to increase the availability of testing and vaccines. Later this week, we'll be receiving approximately 100,000 more masks we will make available to people in need throughout the community. We'll have more information on the details of mask distribution in the coming days. As in the past, we'll face this current surge together and we'll get through it together. This wave will end and the pandemic eventually will subside. But in the meantime, let's watch out for one another. Let's all do our part to protect ourselves and our neighbors. Let's show our healthcare workers that we hear their pleas for help, that we'll be part of the solution, that we'll be there for them like they always are for us. So thank you again, everyone, for the sacrifices you've made and you continue to make and all the hard work you do to take care of yourselves and your neighbors. Thank you.
Thank you, County Executive. All three of us would be happy to take questions now, and I'll facilitate that. So please use the raise hand function in Zoom if you have a question. We'll start with David Wahlberg.
Can you hear me okay?
Yes.
Great, thank you. Janelle, I know that the department doesn't routinely get or report how many of the patients hospitalized for COVID are from the county versus other counties, or how many are vaccinated or boosted. But are you able to share any information along those lines today of the 197?
David, those are, I don't have much more to add, unfortunately. We would ask you to ask our hospital partners what we believe to be true at this point, given the large number of folks who are needing hospital care throughout the state, throughout the country right now. There's probably more folks from Dane County in our Dane County hospitals right now than we've maybe seen more recently, given healthcare's need to prioritize care. But I would ask you to ask healthcare for that data more specifically.
Thank you. Our next question is from Shemaine Mills.
Hello. I am wondering of the reference to masks that will be distributed, County Executive, is that separate from the announcement by the Boys and Girls Club in County, which says it has 250,000 masks that it has ready to distribute?
Yeah, that's in addition to that, Shemaine. Ours will be arriving, probably we anticipate on Friday. And
okay.
So, it's really great to see everyone in the community stepping up and doing their part. So the efforts will be complementing one another.
Thank you.
Thank you. Are there other questions? David, did you have another question? Your hand is still up.
Oh, sorry. No, I meant to lower it.
No worries. We have next Michelle Phillips.
Sorry, I needed to unmute. Hi, I was wondering if there are any plans for considering reopening the triage facilities in Dane County and also Milwaukee. I know that perhaps you can't answer the state question, but do you have any plans for that as the hospitals fill up?
So I can jump in. I think you're referring to the alternate care facility overflow hospital. I'm not aware of any plans at this point in time to open up additional facilities. The big push right now is to support healthcare and having access to staff. But I'd ask you to ask the state about that if there's any more that may have changed.
Thanks for the question. Are there any other questions? I'm not seeing any other hands. So thank you all for joining us today. And as always, stay safe, wash your hands, wear your masks, get vaccinated and boosted. Have a great day, everybody.
Thanks, everyone.